Sign 3. Sudden vision changes in one or both eyes. One of the most overlooked signs of a mini stroke is a sudden change in your vision. And because these symptoms often disappear just as quickly as they appear, it's easy to ignore them. But your eyes are directly connected to your brain. So, when your vision suddenly shifts, it might mean your brain isn't getting the blood it needs. Mini strokes, or transient ischemic attacks, TIAs, can affect different parts of the brain, including the areas that process what you see. That's why these vision issues sometimes come without warning. You might suddenly see shadows where there are none. It might feel like someone pulled a curtain over one eye. Or you may struggle to focus on familiar faces or objects. These changes might not come with pain or pressure, which makes them harder to take seriously in the moment. But whether it's in one eye or both, a sudden shift in your vision deserves your full attention. Let me tell you about Walter, a 75-year-old man who still enjoyed his morning walks. One day, during his usual route, the left side of his vision went blurry, almost like he was looking through frosted glass. It lasted only a few minutes. By the time he returned home, everything looked normal again. He almost didn't mention it. But his wife encouraged him to call the doctor. Good thing she did. Tests confirmed he had experienced a mini stroke. Thanks to that early checkup, doctors adjusted his medications and helped prevent something far worse from happening. The reason this warning sign is so dangerous is because we get used to our eyes acting up as we age. We brush it off as tiredness, dry eyes, or just a bad day. But a sudden, unexplained change in your vision, especially if it lasts longer than a few seconds, is not something to ignore. Your vision is one of the fastest ways your brain can tell you something is wrong. Don't wait for another episode to take action. These little moments matter. If something about your eyesight feels off, listen. Your body is trying to help you before things get worse. Sign 4. Sudden numbness or weakness on one side of the body. One of the clearest and most serious signs of a mini stroke is sudden weakness or numbness on just one side of your body. It might come out of nowhere and go away just as fast. That's why so many people don't take it seriously. You might feel your left arm go weak, your right leg start to wobble, or your fingers suddenly feel like they've fallen asleep. Sometimes a part of your face might twitch or sag slightly. None of this is normal aging. These are strong messages from your brain that something isn't right. A mini stroke usually happens when blood flow to the brain is blocked briefly. Depending on where the blockage occurs, you might lose function in certain parts of your body. That's why it often affects just one side. The left side of the brain controls the right side of the body, and vice versa. So if only your right arm or left leg suddenly stops working, that's your brain waving a big red flag. The problem is that many people explain it away. A man might wake up with a numb arm and blame it on sleeping wrong. Or he might feel his leg buckle while cooking and chalk it up to being tired. These explanations might seem harmless, but they're not. They can delay life-saving treatment. Sudden numbness or weakness on one side of the body is not something to wait and watch. Whether it lasts for 10 minutes or 30 seconds, it's a sign that your brain is struggling. Ignoring it could mean missing your chance to prevent a major stroke. Let me share a story about Harold, a 72-year-old retired electrician. One morning, he noticed his right hand felt weak. He dropped his coffee mug but brushed it off. The next morning, it happened again, and this time, he saw the right side of his mouth sagging in the mirror. That got his attention. He went to the doctor that day. Tests showed he had experienced a mini stroke. Because he acted quickly, doctors were able to treat the cause and lower his risk of a future stroke. Think of it this way: if your neighbor's smoke alarm went off, even for a few seconds, would you ignore it? Of course not. You'd check things out, make sure everyone was safe, and take it seriously. Your brain deserves the same care. That numbness in your arm? That limp in your leg? It's your brain's version of a smoke alarm. Don't ignore it. And don't be afraid to speak up. Many seniors hesitate to tell their loved ones or doctors about these moments, thinking they'll seem like they're overreacting. But there's nothing over the top about protecting your health. Your family, your doctor, your future self, they'd all rather hear about something that turns out to be nothing than risk missing something that could change your life forever. Sign 5. Sudden severe headache without a known cause. Another warning sign that often gets ignored is a sudden, sharp headache that comes out of nowhere, especially if there's no obvious reason for it. This isn't your regular tension headache or the kind you get when you haven't had enough water. This is something more intense. It grabs your attention fast. In fact, some mini-strokes can cause what doctors call a thunderclap headache, sudden, powerful, and unlike anything you've felt before. It might feel like a sharp pain on one side of your head, or a heavy pressure behind your eyes. You might even feel it across your forehead in a way that feels completely unfamiliar. The trouble is, most of us have had headaches before. As we age, we start to accept them as normal. We assume it's just a bad night's sleep or sinus pressure. But if the pain feels different, sudden, or severe, especially if it comes with other stroke symptoms, pay attention. Your brain's blood vessels are sensitive. A mini-stroke might cause a small blockage that leads to this type of sharp pain. And while the headache might fade quickly, it's your brain's way of saying something's wrong. Too often, people ignore these headaches. They take some pain medicine, drink water, and move on. But that moment could be a life-saving signal. If something feels off, trust that instinct. Final thoughts: when your body sends out sudden, unusual signals, don't brush them off. Mini-strokes may seem small, but they're often the only warning before something more serious strikes. You don't have to wait for disaster to take action. If you've experienced any of these signs, vision changes, dizziness, weakness, speech issues, or sudden headaches, talk to your doctor. A quick checkup today could protect your tomorrow. Please comment number 3 if you're still with me, and don't forget to subscribe and turn on notifications so you never miss another life-saving video. Your support helps us reach more people with the information they need. We'll continue this journey together, one step at a time, one story at a time.